Good afternoon, sir. So, I am Axillae de la Paz and I will be your nurse for today. So, what I am going to do is, I'll be performing the assessment of breast and axillae. So, sir, assessing this part of your body is important so that we can know your current condition and identify areas to work on and to improve your overall health and wellness. So, I just need your full cooperation while doing this assessment. Is that okay with you, sir?
Yes, ma'am.
Okay, so now I'm going to wash my hands first. So I'm just done washing my hands. So now I'm going to close the curtains and the door for your privacy. Okay, so sir, I'm just going to ask you a few questions. So what is your name, sir?
Vincent Nimla.
Okay. So, Sir Vincent, how are you?
I'm fine.
Sir, do you have a family history of illness, including cancer?
None.
Do you have occupational or environmental hazards like exposure to radiation?
None.
Okay, so do you take any medication?
No.
Do you have current problems like swelling lungs and pain?
None.
So now let's start the procedure. First, I am going to inspect the breast size for symmetry and contour or shape while the client is in a sitting position. So, I'm just going to check it, sir. Okay. So, your breast size is normal and symmetrical and the color is same as your skin color, and also it is smooth and no edema and no stretch marks may be seen, and your veins radiate vertically, your areola was dark brown, and your nipples are normal, nearly equal in size and are in the same location. Okay, so now I'm going to inspect the skin of your breast for localized discolorations or hyperpigmentation, retraction or dampling, localized hypervascular area, swelling or edema. Emphasize any retraction by having your client. Sir, can you raise your hands above the head? Okay. And next is to push the hands together with the elbows flexed. Okay. Press the hands down on the hips. Okay, sir. So, sir, your breast has no sign of dampling or retraction. Okay, so now I'm going to inspect the areola for size, shape, symmetry, color, surface characteristics, and any masses or lesions. So, okay, it is nearly equal in size, and the shape is round, symmetrical, and brown in color. No masses and lesions. So now I'm going to inspect the nipples for size, shape, position, color, discharge, and lesions. So it is also nearly equal in size. It is well positioned. brown in color, no discharge, and lesions that are present. So now I'm going to palpate the axillary, subclavicular, and supraclavicular lymph nodes. The client is seated with the arms abducted. Okay. So now use flat surfaces of all fingertips to palpate the 4 areas of the axilla. So the edge of the greater pectoral muscle along the anterior axillary line, the thoracic wall in the mid-axillary area, the upper part of the humerus anterior edge of the latissimus dorsi muscle along the posterior axillary line. Okay, so sir, I want you to put your hands behind your back. Okay, I am just going to palpate the breast for masses, tenderness, and any discharge from the nipples. Now I'm going to palpate the areola and the nipples for masses. Okay, I want you to bring this up into your head, and I will do the same procedure what I did onto your right breast. Okay, so sir, your breast has no masses, and that's good. It has very inflammatory transverse, which is normally to be palpate. So sir, your nipples become erect, and the areolas easily proper in response to stimulation, and there is no scar, lesions, or tenderness. Lastly, sir, I am just going to teach you a technique of doing breast self-examination. So first, use the pads of your fingers. Use the pads, not very tips, of your 3 middle fingers for the exam. So use different pressure levels. Your goal is to feel different depths of the breast by using different levels of pressure to feel all the breast tissue.